Research says that more than 30 million people have chronic kidney diseases, and chances are you know someone who has it or is at high risk of getting it. The question therefore we ask ourselves is, what is kidney disease and how can we prevent it? Welcome to Health in this show, where your health is our concern. I am Mawina Latte. We'll be discussing chronic kidney disease. Please stay. We'll be right back.
Are you worried about how to get to all the assemblies, contact of MMDCs or assembly members and other assembly officials, or lodging of complaints among others? Simply call the toll-free number on all networks and you'll be provided with excellent services. And hey, remember, it's a free call on all networks.
So our guest for today's discussion is none other than Dr. Olivia Chalag, who is a general practitioner at UGMC, that is the University of Ghana Medical Center, and she's going to elaborate more or educate us more on CKD, that's chronic kidney diseases. Welcome to Health Tidbits on GHANADISTRICTS TV, Doc.
Thank you very much, Mawina.
How are you doing?
I'm great, and you?
I'm doing well, by the grace of God. Doc, I want to know, what is chronic kidney disease?
Well, so like you've mentioned, you've already classified the kidney disease. There's an acute one and there's a chronic one. So with the chronic one, you see gradual decrease in the kidney function over a period of more than 3 months. So when you see a decrease in the kidney function and it's more than 3 months, then you're talking about chronic. But when it's
okay, before you go to the chronic, which one is the acute? How does the acute?
It's the same decrease in kidney function, but it's happening in less than 3 months.
Okay.
So for the chronic, it's because it's happened over a period of time, a longer period of time than the acute ones. And for the acute ones, many people, the kidney recovers.
Oh, acute one can recover?
Yes, your kidney can recover depending on what is causing the kidney injury. If you are having an acute kidney injury because there was decreased blood supply to the kidney because you bled out, then we replace the blood in a good time, your kidney can recover. We are having an acute kidney injury because there was a blockage in your urinary tubes, and we take out the blockage in a short time. Your kidney can recover fully. Oh yes, because of the short time. But for the chronic kidney diseases, usually it's been going on for some time, and sometimes your kidney is at a point where it's not easy to repair, not easy to recover. Yes.
Oh, okay. So what causes it?
Well, chronic kidney disease has a number of causes, but common top 2 causes of chronic kidney disease. The first is hypertension, second is diabetes. Other less common causes include systemic diseases like lupus, rheumatoid arthritis, HIV. Infections like HIV can cause chronic kidney disease. Overuse of certain drugs like NSAIDs. NSAIDs include our common diclofenac, there are people who abuse it a lot over a long period of time. Tramadol is in a different class. Those are the opioids. So when you use these NSAIDs chronically, you can also end up there. And also toxins that people, especially the toxins that you have in cigarette smoking, over time also lead to chronic kidney disease. So there are quite a number of causes, but top 2: hypertension, diabetes.
So if you have diabetes, chances are you have chronic kidney disease. That's
if you are not managing your diabetes well. So then you will ask, how does diabetes cause chronic kidney disease? So what happens is that when you have a lot of sugar in your blood, the sugar molecules are attached to protein molecules and become a complex. And as these protein sugar molecules combine, begin to go through the blood vessels. So your kidney is made up of glomeruli.
Glomeruli.
That's plural, singular. One is just a glomerulus. It is just a tuft of blood vessels.
Okay.
Small blood vessels called capillaries. Now these capillaries are.
You are using big terms for us. I want you to come down to my level.
Okay.
Calm down.
Blood vessels.
All right.
And there are different types of blood vessels.
Okay.
You know, when you look behind your fingers, you may see veins, but those blood vessels are bigger and thicker. When we talk about capillaries, they are very tiny blood vessels.
Okay.
They are just about 1 cell thick, and they are that way because we need oxygen to pass through them easily. We need exchange of substances to happen easily. And that's what happens in the kidney. The kidney is a very important organ that stands at the middle of a lot of exchange of things.
Okay.
So these thin and very small blood vessels called capillaries are injured by these protein sugar complexes.
Okay.
Now these blood vessels are supposed to be thin so that they can perform their functions well.
Okay.
In the case of diabetes, you have these sugar protein molecules injure these cells, and as the injury goes on, these delicate blood vessels begin to become hardened, and that reduces their ability to perform the functions they are originally supposed to.
Okay.
So if you have diabetes, you do not control your sugars, or hypertension, you don't control your blood pressures, you are destroying your kidneys.
Okay.
So then these blood vessels change in their texture and their function is altered.
Okay.
And that process continues till the kidney is almost off.
Okay. So I'll ask this question: is it hereditary?
So chronic kidney disease, there are some hereditary diseases that some people have that can lead to chronic kidney disease. Otherwise, the top 2 causes, well, hypertension and diabetes are also known to run in families.
Okay.
Okay. But there are some other diseases like the autosomal dominant polycystic.
And you mentioned lupus.
Yes.
How does that? Lupus. Honestly, I was thinking about it when you were talking.
Lupus is an autoimmune disease. That's like, so you see, your body has these soldiers that make sure that diseases that come into your body does not overwhelm you and stuff like that. Now when you have an autoimmune disease, now these soldiers are not fighting the enemies, they are fighting you.
Okay.
And these soldiers in your body, like your immune system, are now beginning to destroy your own organs internally. So that's how lupus brings about chronic kidney disease, because now your immune system is destroying your kidneys.
Oh, okay. So
which ideally shouldn't.
Yeah. What signs and symptoms tells you this is chronic, or this is acute, or this is kidney disease?
So, well, for most patients that we pick up kidney diseases for, usually by the time we are picking, if you are waiting for signs of your kidney disease, usually it should have advanced. But if you see somebody with a puffy face, swollen legs, you can have some of those things in pregnancy. But ideally, it shouldn't stay beyond the pregnancy period.
Okay.
Maybe you have someone who's not pregnant.
But when the person sits for a while, the feet, some people can sit for a while and then their feet kind of swell.
That's different, because you see those people, when they get up and move around, the swelling results. But you see that there are some people, whether they sit or walk, their feet are swollen. When they wake up in the morning, the face is swollen.
Oh, okay.
And then sometimes what even makes people even suspect a chronic kidney, sometimes the person is just presenting with a low HB, like anemia, because chronic kidney disease can lead to anemia. So sometimes you pick it up when the person is presenting with the complications.
Okay.
But generally you see it happening in people whose pressures are not managed, hypertensive patients, diabetic patients, stroke patients, when they fall, when they become acutely ill, and then you do the kidney function test, then you will see that the functioning of the kidney is not what we expect it to be.
Okay. But how do you know your kidneys are healthy? Even though you may see signs, it could be that you're just having these symptoms, but not necessarily kidney disease. So how do you know your kidneys are healthy?
So how do you are heading towards maybe diagnosis
yeah.
disease. So for example, if somebody has a very common test we do is a renal function test, a kidney function test.
Okay.
And then we'll also look at your kidneys with an ultrasound and see, because like I was telling you, these delicate cells have transformed and become hardened. So they have a physical manifestation of that change, which you will pick up on ultrasound. And also because the delicate cells have become hardened and they are not able to perform their functions, you will see it in the parameters of the kidney functions. So in your kidney function, there are different parameters. There's the ions part, and then there's the part that measures filtration.
Okay.
There's something called a glomerular filtration rate. Okay.
Okay. So pronounce that.
So your kidney is a filter.
Okay.
It's picking up the waste products from your blood and excessive water and taking out excessive ions as well. Okay. Do you understand? Yes. So in this case, we are going to measure how well the kidney is doing these things.
Okay.
So the average normal person's glomerular filtration rate is between 100 and 120.
Between 100 and 120. So viewers, we are discussing chronic kidney disease with Dr. Olivia Chalak. And I must say it has gotten very interesting. We'll be right back after this short commercial break. Please stay.
Are you worried about how to get to all the assemblies, contact of MMDCs or assembly members and other assembly officials, or lodging of complaints among others? Simply call the toll-free number on all networks and you'll be provided with excellent services. And hey, remember, it's a free call on all networks.
Hello viewers, welcome back. So before the break, we were discussing some symptoms and causes of CKD, that's the chronic kidney diseases. Doc, how do we prevent ourselves from having chronic kidney diseases?
Okay, so like we talked about the causes, you see. So if you are hypertensive or you are diabetic, you need to control the BPs and you need to control the sugars. Usually for the diabetics, they do it through BPs and also control your sugars. Okay, so the diabetics usually gets the control of the sugars with diets, exercise, and the use of their prescribed medications. And hypertensives also have to take their medications, make sure their cholesterol levels are down, do some form of exercise, reduce alcohol intake, smoking, avoid abuse of certain medications like brufen, diclofenac, and stopping the smoking if you can. But these are the common causes of the chronic kidney disease.
So to prevent that, when you stop all these things, the causes from happening, you may do yourself a lot of good. Okay. But then again, can it be cured?
So it depends on how bad your kidney is and when you attend to start treatment. So you may not necessarily be able to cure, but you may be able to slow down the speed at which your kidneys are gradually dying.
Okay.
Because the kidney disease can progress, the chronic kidney disease can progress to a point that we call an end stage kidney disease. When you get to that stage, that's when we say you should go and do dialysis.
Okay. A person with chronic kidney disease be limited to some form of exercise, probably not eat certain foods or not participate in certain exercises.
So complications of, we are talking about complications of kidney disease from what you're saying. So if you have a patient that with his chronic kidney disease, he has high levels of potassium already, and the patient is battling with the high levels of potassium, such a patient cannot eat potassium rich foods. Because you are actively
high.
You already have high. So if you have hyperkalemia, which is high levels of potassium, you cannot eat bananas. You see, you cannot drink coconut water. But if for some reason the person has hypo, then we'll recommend these. Banana, coconut water, grapefruit, and some of these other things. And even for certain chronic kidney disease patients, we even restrict the amount of fluid or water they drink. Because the kidney has to remove that. The kidney is not able to remove it. Why are you putting so much inside? So depending on the complications that you are presenting with, you will be given a limitation on what to eat or drink. And if you are having problems with your blood levels, it can be recommended for you to eat certain things to also help with the blood level. So for example, the kidney is responsible for producing a hormone called erythropoietin. Now erythropoietin stimulates the production of the red blood cells. If your kidney is off, that erythropoietin will also not be produced. So one of the problems that you have with chronic kidney disease is anemia. So for such a person, if the person is battling with anemia, the person will be encouraged to eat iron-rich foods and things that can help him get some blood,
But can the person also exercise?
It depends on the state of the patient. It depends. So another of the complications of the chronic kidney disease is that some patients may have fluid in their chest, and because of that, it even affects their ability to breathe. Such a patient cannot exercise. So depending on what you are presenting with and what it is you are actually battling with, and the recommendations that you get. You see, so if you have a patient who has, let's say, hyperkalemia, the high levels of potassium, and the patient has an arrhythmia, the heart is supposed to pump in a steady way. But when you have these high potassium levels, it can make the heart sort of flutter, like instead of pumping well, it doesn't pump so well, and then that also brings certain results. Such a person is in a very delicate state,
so the person can't exercise,
may not be recommended for that person. So it depends really on what issues you are presenting with, and then we manage you accordingly. Because everybody does not get all the complications. There are some people who have
all the complications.
Yes.
There are people who have all the complications.
Who have many complications. Yes.
So what's your last words to our viewers?
My last words to my viewers. As I've been in medical school and been in practice for some time, one of the common problems that I've seen is I have nothing against herbal medications, but if you have hypertension and diabetes, please follow the orthodox medicine so that when you have a complication, you even know what to do for you as clinicians. But sometimes you have patients who have hypertension, diabetes, and then they do not manage it, and then the kidney is totally off before they come. So I want to tell everybody to protect your kidneys by managing your chronic diseases like hypertension and diabetes, and also putting in positive lifestyle changes so that you can be healthy.
Okay. Thank you so much, Dr. Olivia Chalak.
Welcome, Marina.
Our discussion is getting more and more interesting. However, this is where time permits us to wrap up. Protect your kidneys and stay healthy. My name is Marina Latte. Thanks for watching.